Hi, I'm here with Cynthia Neiman, Vice President and Chief Marketing Experience Officer at CHOC, the Children's Hospital of Orange County. Our firm led the search that placed Cynthia at CHOC back in 2018. Cynthia came to CHOC with a background in senior marketing roles with companies such as IKEA and Munchkin, Mattel, and most recently at Baby, where she served as the company's Chief Marketing Officer. Welcome, Cynthia. Great to see you again.
Great to see you, Ben.
So you've had a very successful career, obviously, in corporate marketing with lots of wonderful organizations. And now you've been with CHOC for coming up on 6 years. Curious what drew you initially to CHOC and how the transition from corporate to nonprofit has been for you so far.
Gosh, what a journey, Ben. So I had been at Baby for about 5 years and loved my team, loved the people. Wonderful consumer products company, and was traveling about 150,000 miles a year globally. And I knew that I was not ready to retire. I was thinking about what could a next step in my career look like. And my mom was a teacher. I've just always been drawn throughout my entire career, marketing to kids and families. So that deep emotional connection for me is really kind of the foundation of that is really around the kid and family target. And just as I started thinking about this, I received a call from Ben Lambert, and it was just like so serendipitous. And I thought, oh my goodness, I mean, the chance to do well and do good, and I knew this target market very, very well. The role really spoke to me, but I thought I had no chance because I had no healthcare experience. And Ben, the more I spoke to you, the more I realized, this could be exactly what CHOC was looking for, that they were looking for someone with a marketing background who had experience talking to families, but who didn't have kind of a traditional healthcare marketing, very sort of more staid set of experiences. And that's how it happened.
Wow. Well, it is interesting. I'd say maybe since the downturn in the economy, 2008, 10, thereabouts, a lot of our nonprofit clients, healthcare, universities, colleges, standalone nonprofits, have been far more open to people coming with corporate backgrounds and in a variety of different roles, HR and finance, but a lot of them in the marketing communication space. And I think it's a lot of them, before that time, were not as strategic with their marketing communications, not as proactive with that. And the talent pool is a lot better today in those spaces, but there was really a desire to really elevate the game. And I think a willingness to explore candidates with corporate backgrounds and even some agency backgrounds. I'm curious because I get a lot of people ask me about this transition from corporate to nonprofit. If you had a chance to talk to people, marketing communications leaders, let's say, any advice that you might give them on that transition from corporate to nonprofit?
Yes. I think that one of the things that struck me straight out of the gate is just the number of stakeholders that you are dealing with in a nonprofit world. When I was in consumer products, you had your consumers, you had your sales force, you had your board of directors, and that was pretty much it. And now when I think about, the stakeholders that I work with at CHOC, it's, the employees, it is the board of directors. We have a foundation board, which is our philanthropic arm. We have community leaders. We have physicians who are quite separate and apart from our associates. It's a different language with which they speak. It is elected officials and volunteers, as well as donors. So a lot of people who have kind of skin in the game when it comes to a nonprofit and have that deep emotional connection. And you need to speak to them and their concerns in slightly different ways. So that's kind of one thing that I would say is a big shift. The second is for me, and this has just been so refreshing. Having being in a mission-driven organization, you have people who are really in it for the right reasons. I mean, there can be a lot of differences among all of us, but the common thread really is that we are all in it for, the children in our community, and it's just really meaningful. The emotional connection, especially in now that we're looking at a hybrid and remote workforce, it's a way for us to keep our folks engaged in ways that I think would probably be a bit more difficult for corporate enterprises, because that lack of the same emotional connection makes it more difficult. So anyway, those are some of the things I would tell people interested in going into nonprofit.
Yeah, I do think you're right about stakeholders. There's a lot of, you and I have talked about this, but a lot of need for buy-in and consensus, much more inclusive. I think people at all levels have a voice, and leaders want those voices to be heard and valued. And it does, I think, at times slow down the decision-making process, but I think it can also be rewarding to have that collaborative approach as well. So you've been at CHOC for about 6 years. So how are things going, and kind of what's coming up next for CHOC?
Gosh, things are always busy. If we are not dealing with the pandemic, we're dealing with the triple demic, which was the combination of COVID, RSV, and flu.
Oh, sure.
As well as just all kinds of other initiatives. We're building a new Southwest Tower. Our footprint is expanding in our region. And in December, we announced a proposed merger with Rady Children's in San Diego. So this is
Yeah.
very unusual. You typically don't see two pediatric healthcare enterprises merging. And we think what's so exciting about it is the combination of being able to retain and attract top talent. There's just a fight for healthcare talent, and having a larger organization that will allow us to have more opportunities, we think is going to really benefit our people. The ability to train the next generation of physicians, having more research and clinical trials across both organizations will lead to more treatments and cures, and really benefit the kids and families in gosh, I would say not just in our region, but nationwide and even internationally. So there's just a lot of excitement and energy around this. And I'm someone who's been through a couple mergers before. So it's a chance for me to leverage some skills that I maybe haven't used in a bit.
It's exciting and probably pretty challenging, I would imagine, time consuming for you in your role, but definitely keeping you busy. And just want to thank you for your time. It's been great to reconnect and see you again, and really appreciate all the great input and advice.
Well, my pleasure, Ben, and thank you again for connecting me to CHOC. This has been truly the honor of my career to be here. I work with amazing people, and just the stories each and every day. I'll share one with you that is among my favorites. When I came to CHOC, one of the things I noticed we didn't have was an events manager, and it was something I thought we definitely needed. And we put we put a posting on LinkedIn, and probably had close to 300 folks respond in a couple of weeks. And one person who responded, I read each and every resume and cover letter. She was number 253.
Oh my gosh.
She not only had just great experience in the event space and had really done some amazing things, but when she was 15, she was an oncology patient at CHOC. And at the time, she was told that there was an 80% chance that she wouldn't have kids, and now she's the mom of 3. So the opportunity to work with folks like that, I think we have 8 of our nurses in oncology are former patients. It just serves as a constant reminder each and every day about the value that we bring to our patients and families, to the community. And one of the most impactful campaigns I've ever worked on is that when I came, we we launched something called Long Live Childhood. And the
I remember
idea
that. Yeah.
that, when a lot of healthcare advertising looks quite similar, and, particularly I'd say in the pediatric space, you see a lot of, kids who are sick. And for us, a goal at CHOC, and this really leans into my patient experience role, but is that even when a child is going through treatment and something pretty traumatic, we really try to keep childhood alive and well. So we have pet therapy, we have a
Mm.
Secret Studio, which allows kids to, participate in and create their own broadcasts. We have art therapy and music therapy, and just a lot of ways in which we really encourage kids to be kids, even though they might be going through something, medically. Anyway,
Well,
I could go on and on about CHOC, but Ben, thank you again for really introducing me to this role. It's just been incredible.
well, no, thank you, Cynthia. I mean, that's amazing, and yeah, I've seen some of those things, not all of those, but when I've toured CHOC, and yeah, it's a great organization. Obviously, they are lucky to have you, and I'm glad that things are working out. And just thank you again for your time. Really appreciate it.
Great.
Take care. Bye bye.
Bye.